Hey, everybody, it's Christine Garvin, and welcome to Hormonally Speaking. Glad to have you here as always. I'm excited today to talk with a practitioner that has been able to cross and deal with both sides of the equation, is what I like to call it, in terms of using both allopathic medicine and functional medicine in order to help her patients. And her name is Dr. Heather Quaile. And she is a board certified women's health nurse practitioner with specialty training in female sexual medicine from San Diego Sexual Medicine with renowned sexual medicine physician Dr. Irwin Goldstein. She has focused her training specifically in female sexual dysfunction, menopause, sexuality and cancer, sex and pregnancy, and integrative functional medicine. Dr. Quaile is also trained as a sexual assault nurse examiner and a sex counselor, providing sexual health education, information, and personalized counseling to patients of all ages. Dr. Quaile has been working in all aspects of women's healthcare for over 19 years, caring for women of all ages across the health illness continuum. Her expertise includes pelvic floor dysfunction, urinary incontinence, pelvic pain, low libido in women, interstitial cystitis, menopause transition, effects of cancer and cancer treatments on sexuality, pregnancy and postpartum sexuality, and female sexual health. Welcome, Dr. Quaile.
Welcome. Thank you so much for having me.
Wow, you do a lot.
I wear a lot of hats.
Yeah, you do.
I definitely do.
Well, I think it's so amazing to see women and practitioners out there like you that do wear all these hats, because there, in my opinion, and we kind of talked about this right before we got on, needs to be this marriage or this connection between the allopathic and the functional or alternative health worlds. People call it different things. To really bring the best of both worlds to the forefront, right? That's going to help the most people, and particularly women who, traditionally we've been diminished in terms of healthcare. Our, pain isn't real.
Oh yes.
Especially
all my soapboxes.
You're like,
let's not even get into sex education either.
Exactly. I was going to say sexual health. I mean, that's not even talked about for women really at all,
Exactly.
right? And so, I mean, there's so many things that I could ask you, but I guess I'm curious, first and foremost, what are the most common, sexual health issues that you see for women?
Absolutely. And I do see a lot. And my most common, though, I would have to say, is something like a mismatched desire, which is also called in our world hypoactive sexual desire disorder. It can affect men and women, but most of the time it's more of women having that hypoactive sexual desire. Now, of course, I see women that come in and say, my partner doesn't have the libido, but I do.
Right.
And
I bet there's issues around that too, right? Because women are like, that's not how it's supposed to be.
Exactly. So that can play out both ways. And then, of course, I see a lot of problems around sexual pain. So that would encompass things such as vulvodynia or vulvar vestibulitis, where there's pain and burning in the vulvar vestibule of the female anatomy. I'm really anal retentive about anatomy, where the vagina is the canal and the vulva is the outside. So I always kind of put that out there for everyone. It's just part of Sex Ed 101.
Yes, thank you.
And so I see that quite a bit in my practice. And then I do a lot around menopause care, caring for that patient that's kind of in that perimenopause to menopause to postmenopause transition, where they go in and they may see a provider and they say, I have sex, it hurts. And just the fact that they can tell their provider they're still having sex in their menopausal and post years, you should be like, yay, congratulations, it's awesome.
Yeah.
And no, it shouldn't hurt.
Yeah.
Where a lot of times they get brushed off. So I get a lot of those type of patients. And then I do see patients after cancer, because unfortunately the cancer docs are amazing and they're getting the cancer gone. And that is kind of where their narrow focus. Let's get the cancer off of you and get it better. But then they don't think about the aftermath of post-cancer survivorship and what that looks like sometimes for a patient. And oftentimes sexual dysfunction is a huge aspect in that as well. And then, of course, I see some things around pregnancy, postpartum, and sexual dysfunction, as well as kind of more of my love passion project is the trauma that comes with
Hmm.
sexual dysfunction too. So human trafficking, sexual assault, transgender care, things in those nature. So again, I try to wear a lot of different
Yeah.
hats. It just keeps my days different, busy.
You are definitely covering so much of it. So
Yeah.
going back for a second to the cancer support, that's so interesting. I actually know a woman who's in her mid 30s who ended up having endometrial cancer,
Hmm.
and has to now go through radiation and chemotherapy, and obviously that's going to kick her probably into, I mean, early menopause. Actually, she had a hysterectomy, so I don't know if it was full or not, but anyways, yeah,
I
it's
would
going to kick her.
imagine it was, and they
Yeah,
probably took ovaries, and yeah, that probably kicked her into menopause. And if
menopause
they didn't, the radiation or the chemo would.
will do it. Yeah. And even thinking about, I had experience of having to go through surgeries, and what you said about the doctors, like their focus is like really getting you through that,
Yes,
and is so grateful for that, and so grateful for
yes,
the good surgeons in the world. But then you're kind of left afterwards to sort of fend for yourself in a lot
yes,
of time, approaches.
yes.
So it's like having someone like you working at a practice for for cancer, for female cancers. I mean, is that a world that we'll ever have?
Well, it's part of why I left traditional practice and why I started my own practice. My
Mhm.
practice is the Show Center, and it stands for Sexual Health Optimization and Wellness. And what
Mm,
it led me to do is do it my way, where
mhm,
I can kind of blend, and we'll talk about this more, a lot of that Western medicine or the allopathic, if you will, with some of that integrative functional,
mhm,
and kind of really hone in just on sexual health. I don't,
mhm,
like I always say when I go talk to the gynecologists in town, I don't want to take your patients. I don't want your annuals. I don't want your OBs. I don't
mm,
want to be someone that is stealing patients from you. I just want to be an extra arm where I know with the mandates of insurance and the way things are, especially for women and how marginalized we are,
mhm,
they're not going to pay for sexual health, and you're not going to have time with insurance to even answer the question, let alone ask.
mm,
So send
mm,
them my way. I will deal with it. We'll work on it together. And I'm going to send them right back to you when they get pregnant, when they need their hormones, when they
mm.
need whatever. And we're going to work together.
That's so interesting because I didn't even think about that aspect, right? Of the hard part for functional medicine with a lot of people, or functional health, if it's not a doctor, is that they can't access it because of the insurance, right? The lack of
Right.
insurance coverage. So you're kind of
I try to blend the two. And I'll be
right.
honest, I try to use insurance whenever I can for a
Hmm.
patient.
Hmm.
So, are there tons of functional blood work and labs and things out there? Yes. Are
Yeah.
there some that are phenomenal? Yes. Are they crazy expensive? Yes. Can
Hmm.
I figure it out with traditional blood work on some things? I like to believe in some ways I can. And when
Yeah.
I can and I can use a patient's insurance, you better believe I'm going to bill their insurance for labs and
Yeah.
things that can get billed out for.
Yeah, absolutely. And, I'm actually just right now in a continuing education training on using blood labs. And there's actually quite a bit of information you can gather from those,
Yeah.
it's
They need
pretty
to
amazing.
share that wealth with me because there's so much out there on functional labs
Yeah.
that it kind of is overwhelming. And
Oh
you're
yeah.
like, do I do blood spot? Do I do saliva? Do I do a
Right.
urine? Do I do just straight up
Yeah.
blood?
Yeah. I mean, it's never ending, right? Because there's new tests coming out all the time. But for some of the basically what we're learning is, some of the getting ahead of issues, whether it's thyroid or cardiovascular, and nutrient deficiencies. Like there's a lot more that we can glean from the serum labs that you just go
Mhm.
get every year anyway, that are most likely going to be covered by your insurance. And then, but when it comes to hormones and stuff like that, the dried urine and the saliva tend to be
Yes.
better.
And you're going to hear so many schools of thought. I mean, I
Yeah.
have functional people that'll tell me one way. I have
Yep.
physicians and nurse practitioners that are taught allopathically that we all have differences of opinions on it. So,
Yeah. Yeah, exactly. And that's the thing, I try and tell my clients this too, and just people that are listening. It's like, it's not that anybody's wrong. I mean, I really think that all of these paths can be very, very helpful. It's
yes.
just, what do you sort of connect with and attune to at that time, and also knowing, okay, so there may be this period of time working with this practitioner that's great. And then it's time to move on to someone else
Yeah,
too, so
absolutely.
yeah. So
Absolutely.
let's get back to the trauma component, because I think that this is something that is not focused on enough.
No.
I just, for people to listen to the Hormone Summit recently, I brought in a therapist who talked about, trauma and that being an underlying issue with hormonal dysfunction. So especially with like maybe vulvodynia or some of the other things that you brought up, can you tell us how trauma plays a role there?
Absolutely. So I actually always kind of started off with an Instagram post that I put out there, and it's kind of like a quote I always share. And it's always trauma shapes your life. It should be part of
Mm.
your care too. And I
Mm,
think
so
that
good.
that is so powerful. And I always try to kind of hone it in that way for a patient. So unfortunately, you experience, let's just take sexual assault because I'm not going to say it's easy, but it's easy to put in perspective, and then we can dive back to vulvodynia.
Hmm.
You get in a situation and there's a sexual assault that happens, and it's horrific and it's horrible, and perhaps you go through the whole process of having a rape exam, prosecuting, et cetera, and then you get to a point where you go through all the stages of grief and denial and everything
Hmm.
that you go through and you process. And now maybe a few years later, and it's different for everybody. It could be 6 months, it could be 10 years. You're ready to maybe start getting back to life as you knew it, maybe get into a relationship.
Hmm.
And there's a trauma component for sure that goes with that. And again, it has to be part of the care that's built in to how you're going to kind of treat that patient. So how are they going to be in that relationship? How are they going to communicate with their partner? Is there going to be a trauma component every time they try to have a sexual relationship, or there's any kind of intimacy because there is a rewiring of the brain, or you have this synapse that you have this trigger? And so
Hmm.
I sometimes think about it that way too when I'm dealing with my sexual dysfunction patient that may have like a vulvodynia, for example. She may say, well, I don't have sexual trauma, so I don't know how you can kind of look at it that way. But I kind of look at trauma beyond like that sexual piece. Trauma can also be pain. When you're experiencing pain all day long because you have rawness and burning in your vestibule and in your vagina, and it's hurting, and you can't sit and you can't move and you can't wear jeans or leggings, you barely can get to work, that is trauma.
Oh
And
yeah.
sometimes we just don't maybe think of it that way, but you're living in that phase of trauma every single day of your life. And again, it shapes you. And so you need to learn how to care for yourself to maybe not have triggers, or to how to
Mhm.
live inside like a trauma when you've had trauma in your life.
Yeah. So do you tend to find that, there are different things, I don't know, different therapeutic models that are helpful for people in those cases? Or are you kind of able to work with them just one on one and get them past this?
So I think anything in the world that involves a sexual dysfunction really involves what I like to call a biopsychosocial approach. And we talk about it all the time when we are at conferences or among some of the sex med great people. And a lot of times, people that may just dabble a little bit, for example, providers like, hey, I saw a patient that may have some pain, let me fix it medically, send her off on her way. That doesn't look at that whole holistic biopsychosocial circle, almost, if you will. Or if you think about
Mhm.
it as a Venn diagram, here's the medical piece, here's the pelvic floor piece, here's um, the therapy piece of it, if you will. And it's broken up into segments. And so sometimes we segment each piece for a patient, but we don't take it into its wholeness, if you will. So
Mhm.
when I see a patient, I try to focus with them on all those pieces. I may not be, even though I'm a sex counselor, they may end up needing sex therapy. So a lot of my patients that have had, for example, a sexual assault, I know my limits, and I'm like, hey, I can help you get to a great sex therapist who may need to do a lot more than what I can do,
Mhm.
and who also may need to have that background of being a professional counselor to do cognitive behavioral therapy, EMDR, some of those psych pieces. And then,
Mhm.
of course, we have that PT piece where I know I don't touch that PT piece. You need to see a physical therapist. Let's say you break your arm. you're going to go see a physical therapist. So why are we so weird about seeing physical therapy for our genitals? And
Right, right.
like it's just physical therapy. Consider the genital like it is an arm, and
Yeah.
you're getting it fixed. So you go that route. And then we have that medical piece. And I think they need to work in this beautiful, happy medium of everything together to really be what's best for the patient. And I think that is what really kind of hones in on that trauma informed care by honing in on all those different components.
And I mean, that's what I wish for everyone, right? That we have a holistic team to back
Mhm.
us in any kind of issue, chronic issue that we have. And obviously, with any kind of sexual issue, particularly, anything that's connected to deep, deep. And I'm not trying to take away from other trauma, but from being
Right.
raped or
No,
anything,
exactly.
it's so intense, right? And it's like to even try and focus on just having one practitioner help you. Yeah, I can't even imagine.
I think it's hard.
Yeah.
I think we need to be so much more accepting of we cannot be this jack of all trades. I think I
Mhm.
started that way in medicine and I'm
Mm.
like, I can't do
Yep.
everything. But
Yep.
I can know a little bit of pieces of everything to know where my limits are to say, you need this.
Mhm. Mhm.
And so I'm going to get you the help to get to that.
Yeah, so amazing. So we've talked a little bit about, these different components, and I always love when pelvic floor therapy comes up because that like was a huge savior to me after my abdominal surgeries, right? And I went really to just rebuild my core safely because I was
Mhm.
very scared of a hernia, and then it really opened up the world of like I didn't know that the left side of my vagina, that muscle was so tight until I went to pelvic floor therapy, and that I'd probably been holding it that way God knows how
Yes.
long. But
And when we're stressed and tense, you don't realize that a lot of your stress, anger, tension actually sits in our pelvic
mhm.
bowl or
Mhm.
that hammock region of the muscles. And until you kind of have someone explain that to you, you're like, oh, well, maybe I do clench, or maybe
Right.
I'm not doing it properly.
Right. And it's interesting because some people, when I've told them, because I will go around and tell every woman that they should have pelvic floor therapy at some point. But they're like, ooh, the internal part. And I'm like, it literally it's kind of like when someone you don't know a muscle is tight until on your neck, until somebody touches it. And then you're like, oh my God, that's so tight. It's the same thing internally. And I actually appreciated, and I can imagine that this can be helpful maybe in sexual trauma situations. I appreciated working with that area with a practitioner without it being sexual in any form or
Mhm.
function, it helped me develop actually a different relationship
Mhm.
with my whole reproductive system, and
Yes.
so I think there's so much power in that too, in healing trauma too.
I think you speak to a really important thing, that pelvic floor is so wonderful because it gets you in tune with your body. And that kind of goes on to my caveat of just that's the one thing I talk to all my female patients about is get in tune with your body. Take a handheld mirror, go sit in the bathroom with some light or somewhere and take a glass of wine and get to know your body.
Make it fun.
That could be a whole other podcast on an
Right.
like we should have that self
Oh,
exploration and
yeah.
looking and knowing your parts. Like I said when we started this, I'm like, there's clearly a difference between a vagina and a vulva, and unfortunately we don't get good sex ed.
I
So
know. I
it's
mean, and
horrible.
I've talked about this on another podcast. I can only imagine the difference of girls being empowered if they were taught at a young age their anatomy, and also starting to understand their bodies so they know what feels good to them, because
Yes,
I think it's a lot easier to say, to set your boundaries when you're clear on what feels good and what doesn't feel good to you.
exactly. And don't get me on my other soapbox of if you feel like that needs to be important for women, how do you feel about people that kind of fall on those gender lines of
Mhm.
LGBTQ? Like we
Mhm.
have horrible sex ed, and oh good God,
There's
they
a
don't have any sex ed.
yeah,
So they don't
yeah.
even know how to navigate this. So when we're seeing teens that are questioning their gender identity and their
Mm.
sexual exploration and things like that, they don't even know where to go.
Yeah. Yeah,
And
and there's not many resources there
there's
out there
none.
all
Well, I shouldn't say there's none. I actually use quite a bit scarletine. I don't know if you're familiar with
I've
it,
heard, yeah.
but it's a good
Yeah.
resource for teenagers. But if we don't start educating younger, which a lot of people are like, oh, I don't want to tell them about that. They're too
Yeah.
young. But if we don't start educating younger, they get into our ages and then it's taboo and they don't talk about it and they don't want to look at their bodies. And maybe it would put me out of business because we wouldn't have any sexual dysfunction if we would start
Right.
basic 101 and talk about consent and what sex ed should look like.
Yeah. Well, I don't think you'll be going out of business anytime soon in this world, right?
Yeah.
Sadly.
Sad.
So let's also talk about the component of the gut health because that's my thing, right? So that's like this other arm
Mhm.
of this overall health. So even like in a case of vulvodynia or some of the other things that you see, how do you see gut health playing in?
So I think, and again, this is kind of why I left to start my own. I think there's a beautiful blending of that allopathic with functional medicine. So, is there a true algorithm that we follow on vulvodynia? Absolutely. And it's been published and it's been widely
Mm,
studied. But anything that's been published and widely studied, there always is little arms that can kind of jet off of things too. And that's the beauty of science and the chain
mm,
things that happen.
mm-hmm,
So with vulvodynia, a lot of times it could be something that may have been hormonally mediated, or it could have been triggered by a yeast infection that makes it like a neuro pathway. Lots of different
mm,
things. So there's definitely clearly demarcated pathways when you're dealing with it. But then sometimes you need to think about that. Functional component, if you will. And I think that's where the gut really plays into a lot of it. So I have a couple patients that I've seen that get vulvodynia that triggered from a yeast infection. And
mm-hmm,
when we kind of break down a yeast infection, a lot of that candida and all of the overgrowth is starting in that gut. And when you kind of break down their diet and you talk to them about what they're eating and what they're doing and what their stress looks like, the gut really kind of plays into that because if you can't balance out the gut and get it straight, they're going to keep getting those yeast infections, which are going to keep causing the burning, the rawness, and all of that into the
mm-hmm.
vulvar tissues. Um, and then that also kind of interplays in and when you have something like pain and trauma and stress, it affects your adrenals. So you should be thinking about just adrenal health, which we look at from a functional perspective as well. So I think there is a huge blending and a marriage between the two. And I'm hoping in the next several years, I mean, we've gotten better about certain things and hopefully we get better about adding a functional layer into some of our more medical minded heads.
Hmm. Well, I, can say from personal experience, I dealt with candida kind of all through my 20s. And I later put together, as I got more educated on the subject, that the 3 rounds of antibiotics that I took in college for strep throat, that was, nobody was talking about taking probiotics post
Mhm.
antibiotics then or anything about, beneficial bacteria. And at least at this point in history, that is a discussion. I feel like, and
Yes.
even, most doctors will say at this point, do some kind of replenishing of that beneficial bacteria after you're
Yes.
done with
We
antibiotics. So
definitely hear it more for
yeah,
sure.
so at least there's baby steps, if not the whole maybe way we want to be about it. But yeah, yeah, with candida it can be such an overwhelming kind of thing, and people definitely just don't dive deep or know about that the um really the food component that's so deep, right? And
Yeah.
that's an emotional aspect too to work with sometimes.
Yes. And I think
Um,
our food has changed so much because we now have so much processed junk that's
yeah.
out there. More things that are easily accessible and vending machines. And we're a very high stress society. So, oh, let me just go grab fast food or get
Mhm.
something from the vending machine if I'm at school or whatnot. And that doesn't help at
Yeah.
all.
Yeah. And then the added, because we're trying to get all the things done and going, going, going. So you drink more caffeine,
Mhm.
which impacts your adrenals and so on and on and on. And so, yeah, so much of it is getting people to understand their stress levels, is honing in on that diet and kind of understanding what really feeds you, and getting those nutrients you want in there.
Yeah.
And but it is fascinating. Had a woman on who has dealt with vulvodynia for years, and I was amazed by her journey, right? Like, I mean, she
Now,
basic
usually they have a pretty extensive journey because
yeah.
most of the people that I see have been to multiple providers before they've even found me.
Right.
Because they
Right.
think like, okay, it's a yeast infection. I'll just keep getting it treated. And then they're on
Right.
their 15th treatment. They're like, what's going on? Then
Right.
it's doctor to doctor to doctor to doctor. So most of them do have quite an extensive journey.
Yeah. And she did, she basically did a lot of the things that we're talking about, and it got better and better and better, but there was still, she said she was probably at about 80%. And then Botox ended up being the thing, which I thought was really fascinating,
Yes.
getting that it done in there. And that's like a good example, right? Of like, she needed to do the gut healing. That was a huge component of it. But then that got her to 80% or whatever you want to say. So then, it was this thing from allopathic medicine that kind of put it to 100%, And so I thought that was actually a perfect marriage of using both those worlds. Like if she had just done the Botox on its own, I don't know if it would have gotten her
I
to
don't
that
know if it
place.
would have, and it can be a traumatic procedure for
Yeah.
some with the
Yeah.
thought of injecting
Yeah.
Botox in your genitals and needles
Right.
and things. So it's like you've got to build to that, and it's obviously not a first line treatment, of course,
Right.
but again, it's kind of a marriage between the two. Like I always said, like I can't truly fix your vulvodynia unless you're willing to kind of put in the homework, see a physical therapist, do the work
Yep.
to get your body better. And
Yeah.
then there comes a counseling piece of it too,
Yeah.
where it's not a one size fits all. And like you said, that's why most of these vulvodynia patients have a journey.
Yeah. And I mean, I think most illness, right, is a journey, because it is not just about the physical sort of manifestation. It is the underlying emotional components
Yes.
that I think, our bodies are kind of knocking for a long time. And then
Yeah.
finally it's like, all right, you're going to listen to me, whether you like it or not. And I see
Right.
that with hormone issues that come up for women, that are so prevalent now, even younger, right? Not even just in perimenopause, and even maybe perimenopause starting earlier than we had traditionally thought, and the symptoms coming up, and it's our bodies have been through a lot, I think, as women,
Mm.
and particularly with the stress that we're under in the world now,
Yeah.
too, the constant
Yeah.
going, and our bodies are not made to do that. And so you see so much of our bodies working really hard for us, and then at one point being like, "That's all I can do."
Well,
I need, I,
you need to fix something or it's
yeah,
not going to continue like this.
yeah,
So a wake
absolutely.
up call.
So I want to jump back a little bit. You talked about working, with women who have been through trafficking and sexual trauma and all of that. So I remember reading that you had you're actually working on was it legislation and lobbying? So I'm super curious about that in terms of what you see happening right now, because I'm kind of scared to ask, but I'm also super
Yeah.
interested.
Yeah. I will be honest with you. It's very hard to wear a hat of a women's health provider and also be a military spouse to a very conservative
Mm,
husband. And I am
whoa.
I honest to God think I'm a true Democrat, and I cannot believe I'm saying that out loud. People that are going to listen to this, because they're going to be like, "Oh my God, I thought you were always like a Republican." But I feel like as I've gotten older, and as I've gotten my doctorate, and as I've seen the legislative process, and as I've opened my own clinic, and I see all the hurdles, and I see how marginalized my community of what I care about is so marginalized, and I
Mm,
see it as women, and I see it not being a woman as also being a woman of color, because most people look at me and they're like, "You're not white," and I'm like, "No, I'm Hispanic," but
mhm,
everyone just sees me as this white woman. I feel like
mm,
in a lot of ways I have got to be more on that left side to kind of fight for that, and
mm, mhm.
it's definitely opened my eyes to a lot. I'm terrified where we're going and where we're going to be come November 3rd. We will not have a president if I was to guess, but today is not a conversation.
That would definitely be a whole other podcast.
But I think to kind of answer your question, I went and got my doctorate way later in the process. I've been a nurse practitioner for about 16 years. And this is a lot of times what I tell my students. I
Mhm,
say, and this is where I think very differently than a lot of my counterparts who are teaching in the nursing doctorate world, is I think I did the right thing to wait to go get my doctorate 16 years later, because I kind of knew where the problems were in medicine and in nursing and what I didn't
Mm.
like and what I wanted to fix. So I
Mhm.
took a
Mhm.
problem, and believe it or not, it was in pregnancy and in like a triage when I was taking care of nursing students and working in that hospital setting. And now I don't do anything with it. My love is sexual health,
Yeah.
and I kind of wish I even would have waited even longer because I would have
Mm.
done something around sexual health, but that's neither here nor
Right.
there.
It all leads to each other,
Something,
right?
every
Yeah.
step is
Yeah.
for a reason, and we
Mhm.
don't know why. But long story short, um, it got me into legislation and policy, and I started learning more and more about what it looked like. And so I started reaching out to some of my friends here in the local Georgia area, and they're like, hey, come with us to the Capitol and let's talk about nursing issues and rural Georgia and how rural Georgians can't get health care because we won't open barriers to help with nurses to be able to practice to the full extent of their nurse practitioner
Mm.
certification. So I have to have a collaborator to work here in the state of Georgia, and there is not a set demarcated line on how much they can charge me per month to
Ooh.
collaborate for me.
Right. Collaborate. Yeah.
And I think that there is a happy medium. Do I think someone out of school should be opening a practice and be practicing on their own? God, no. I mean, I teach students, but someone with 19, 20 years of experience, do I really need a collaborator on all things? Do I collaborate? 100%
Mhm.
yes. Do I
Mhm.
know what my limits are? 100% yes. But do I need someone signing a chart because it's just what my state recommends or
Right.
mandates? No, it's
Right.
frustrating. So that's
So
kind of how
frustrating.
I got into that whole legislative realm. And then what that showed me was that we have so many other issues that I needed to kind of put my arms out for: trafficking, all these things. And I think the scary part is, like, you see these people that are in the Capitol and we kind of hold them up in this like ivory tower, and how am I going to talk to them? And I
Mm.
think what I even tell my lay people and what I tell my students: don't ever be afraid in going and talking to your legislators, because if it's something you're passionate about, I promise you, you're the expert on it if you've taken
Mhm.
the time to go and research it and understand it. And they are hopefully there to listen and to kind of garner your words and advice so that they can take it back to their people and talk about it, because you are their constituent and they should give you the time of day. And that's kind of where that whole legislation and policy has been a really good thing, about just learning that I truly am the expert in what I'm passionate about and can go talk to them
Mhm.
and they
And
listen.
have you seen any shifts and changes in this process?
So we're very behind in Georgia, but I
Yeah.
will say that we did, and I'm horrible because I forgot the number. It was like Senate bill, or maybe it was House bill like 321, and don't quote me on it, but we did just get passed for nurse practitioners to be able to order mammograms. Good Lord, I
Oh
can't
my
even believe I'm
goodness.
saying that, because
Yeah.
we are the last state in the country. I mean, there are 22 states or so now, and I may be wrong on that number, but close to 22 or more that have full practice authority where nurse practitioners can practice to the full extent. And here I am taking the little wins and saying I can write for a mammogram now, and my overseeing physician doesn't have to sign it.
So, I mean, it just makes me think even about when I was in the hospital, and I'm not trying to take anything away from the doctors, but the
No,
nurses are the ones that are like doing all the work.
we're the front line. Let's be honest. I
You,
love my doctor counterparts, and I have learned so much from them over the years. And it's not Heather Bash the doctors at
yeah.
all.
Yeah.
But there needs to kind of be this happy marriage of it all, and I just don't feel like we're quite there.
Right. And to me, watching it every day, these nurses that would be with me for 12 hours, and a lot of times I would see them, 2 or 3 days in a row. And so they would know what was happening with me, and it's like, but they can't override what this doctor who's seen me for 1 minute, you know,
Right.
is said for that day. And I would obviously kind of, even though I was out of it, notice the frustration. And also it just didn't, yeah, it makes no sense to me, especially with some of those nurses having so much, yeah, just so much experience, So, yeah, I mean, it doesn't surprise me about Georgia that it's a little bit, on the,
We're a red state.
yeah,
We're very conservative, and
yeah.
hence I tried to open a sexual medicine practice
I
in
know.
the South that doesn't talk about sex. So I'm batting 1,000 here, but you know what? By the time I retire, I will have women going into their primary care providers and saying it's important and that we
Yeah.
need to talk about it.
Yeah. And I think that's such a good shift for this country in general, right? I mean, before we got on, we were talking about how I don't think that a lot of women even understand this idea of sexual health
Nope.
as a concept, right? It's just,
No.
oh, I
And
have something going on down there. I'll go to my OBGYN and just get
that, or they don't even understand the concept that sexual health encompasses more than penis and vagina penetration.
right, right, right. Yeah.
And that is a lot of what I spend my time counseling my patients on, is
Mm,
they were like, oh, well, I just kind of have gone through the motions, or it's what I was told I was supposed to do. And they've never really explored what intimacy means outside of that, or what it
mm-hmm.
should look like, or that sex shouldn't hurt.
Right.
So come up with other means or communication.
Yeah.
So that's eye opening. And then explaining to most women you're not alone, and that most women can't achieve an orgasm off penetrative intercourse.
And
And so
yeah,
I think that that is just, this light goes off and they're like, really? And I
yeah.
think just half of it is just getting out there and talking about the uncomfortable, and giving women a voice to know that all these things that we've experienced or we've held in because that's how we've been taught by society, maybe we should be asking the questions and exploring, because there's no right or wrong answer on it, you know.
Yeah. I mean, I just had this memory of a friend when I was younger, just flabbergasted that I didn't have an orgasm, from penetration, and like how that sticks with you, right? And that belief system, and that,
You're broken.
yeah, exactly. And then you don't want to talk about that to people because you're like, actually, I didn't feel broken. I was like, whatever, you're thinking that your
Good,
way is the right way.
good, good, because
But
then you're my novel, like the novel concept
right,
here, because
right.
most of my women think they're broken, you
Yeah.
know,
Yeah.
and
I was
especially,
also I was also the one that got a vibrator like as soon as I went to college. So, I was like, let's try this thing out, see how that works.
and that's the other thing, like living in the South,
Mm.
you don't really talk about vibrators. So I call them blood flow devices, and it's really good for the genitals because it brings blood flow and it helps with just everything kind of feeling better and moving and doing what it's supposed
Totally.
to.
Well, yeah, actually, I guess I got my first one right after college. I was thinking I got it in college, but it's funny because I got it in San Francisco, right? Once I moved to San Francisco, it was okay to do it. Um, but yeah, when I started doing pelvic floor therapy, what, a year and a half ago, it was funny because she totally was, we were talking about at home exercises, and she was like, oh, so, there's a medical device that you can use. And I was like a dildo? And she was like, kinda.
Dilator. But if
And
you call it a dildo, people are going to freak
yeah,
out. So we call it a dilator,
yeah.
because it just sounds better.
It's so funny because she was like showing me online where I could, and I was like, I'm covered, I'm good,
Yeah,
And then, and I forget what she called the vibrating version, but I was like, still covered, But
I call it a blood flow
there
stimulator.
you go. I love that. So real quick, going back to the human trafficking aspect, what's happening with legislation on that
Oh,
in Georgia?
that is actually one thing. So, our first lady of Georgia, Marty Kemp,
Mhm.
that is one of her huge initiatives.
Mm.
So I got tapped in back in 2009. Where are we now? 20. Okay, so late 2019, I got asked to help build a trafficking center for teens in Georgia, 12
Oh
to
wow.
17, male, female, and transgender. There was already a nonprofit that existed that had been in this for 19 years. And so they had a lot of different avenues for traffic participants, but this
Hmm.
one was going to be specifically for teens in emergency stabilization. So
Mm.
we're a 90-day program. I was able to start the medical program with a phenomenal nurse and our overseeing physician and a couple other great people along my path. And it's one of the big things that we're maybe kind of starting to do right in Georgia, is
That's
really kind
awesome.
of getting behind the horrors of this.
Hmm.
And I always kind of say, like, don't think it's not going on just because I say it's here in Georgia. Everyone's like, oh, it's Atlanta. It's just the Super Bowl was there. You're the trafficking capital of the world. You
Mm.
got the airport. No, it's happening in everybody's backyards,
Yeah,
sadly. It's
absolutely, absolutely.
$150 billion business.
Jesus.
And I'll leave you with this awful, awful, awful quote because it will send chills down your spine, but it's the truth. You can sell a kilo of Coke one time a night. You can sell a girl 7 times a night, 7 days a week, 365 days a year. And that is why it's $150 billion industry, and it's sickening.
I mean, that's definitely a whole, episode unto itself, but
Yep.
beyond, like, how is beyond legislation, how is this going to change? It's like, how do we get to people when money is the most important thing, obviously, and human life isn't, and autonomy isn't. But yeah, I mean, do you have any insight there?
I have my own thoughts on it. I
Mhm.
think, again, it comes down to education. I think that we need to be getting in some of the schools where they're younger, like before they hit middle school, maybe
Mhm.
in fifth grade, maybe even in sixth grade, that we're going in and we're talking about this. It's uncomfortable, but kids need to hear this. I
Mhm.
mean, my kids knew at such a young age, and I'm raising three boys. Um, they'll sometimes be like, oh, can't be out there. My mom will worry someone will pick me up and traffic me. And people kind of just laugh like, oh my gosh, how do you know that at such a young age? And he's like, my boys will always tell you my mom's an open book. You'll never know what you're going to find in our house. A sex counselor. But
That's so great for them. I'm actually glad that you have three boys. You know what
uh,
I'm saying? Raise them well and put them out into the world.
yes.
We
So I
need more.
think there needs to be more education. There needs to be more sex education. But I also think that there needs to be harsher um, liability. Like, I mean, just
Mhm.
things like we're going after the traffickers, but why aren't
Mhm.
we going after the Johns that are looking for the traffic? Like, why are we
Mhm.
not going after these
Yeah.
perpetrators that are going for these young girls and having sex with them?
Yep.
Why is it that we're holding them up in hotels and the hotel managers having sex with the girls there? I mean, it's
Mm.
awful, some of the stories I hear, and I'm like, what is going on in this fractured system?
Yeah.
So I definitely have my own thoughts around it, but I think we just need a lot more. Instead of saying like, oh, we know it's a problem, what are we going to do about it? And
Yeah.
how are we going to educate, and how are we going to stop it? And are you comfortable if you see something that may not seem right? Maybe you should call the police, or maybe you
Mhm.
should call and say something,
Yeah.
like part of it
Yep.
is just educating.
And none of us are free until all of us are free, right? And it's, I mean, I look at these things from a holistic perspective too, of, how can sex be, um not even, I don't want to say a good natural thing, but how can it be okay when we have so many people that it's used as a
Yeah.
weapon against?
Mhm.
And so that deep healing needs to happen for all of us, not
Yep.
just the people, not just the quote unquote, victims.
Yep.
So yeah, thank you for doing that work.
It has been the hardest and most humbling and most rewarding work I think I have done in my entire career,
Yeah.
hands down.
And I'm sure so painful too, to have to see
So
that.
painful. And I think that I really had to change my expectations. I
Mm.
think I went in there, and I mean, I've seen hard stuff. I'd been doing rape, sexual assault exams for a long time, but trafficking is different. And a really good colleague who's also my medical director for the center, that the trafficking center, is like, Heather, we are only going to help 10% of the patients that walk through this door.
Yeah.
And she's like, and when you can open your mind to accepting that, and not real and realizing that they are going to fall again and they're going to mess up, and we are just kind of here to help, but accept the fact that it's just this small little 10%, you're going to wake up every day a little bit more attuned to like, okay, I'll help what I can and know
Mhm.
that it's not my fault if I can't.
Mm-hmm. I think
Because I'm a
that's such good advice in so many ways, though, right? Because
yeah.
so many of us, I think, want to help everyone, particularly
Mhm.
obviously in situations like that, and we can't.
That's my nature.
Yeah.
I'm a fixer, I'm a
Yeah.
helper, I'm a healer. And so when I can't, I feel like I put a lot of stress on myself.
Yeah. Well, I think it's amazing work that you're doing on
Thank
so many levels. It was
thank you.
helping women in so many ways. So thank you for doing that. So how can people contact you?
So my website is www.theshowcenter.com.
Mhm.
I'm on Instagram. I would love more love on my Instagram. My goal is kind of to get to that 1,000 marker, maybe by the year, by probably won't not the end of the year. I just started really being serious in June. So I'm like, by next June, I have to have 1K. I'm at about five something. And my handle is at Show Center, SHOW Center, Dr. Q.
All right. People go follow her. help her get to her goal. Great. That's awesome. And then
Yeah,
do
and I
you,
talk about all things like trafficking and sex ed and sexual health and sexual dysfunction. So it really is an education platform on my Instagram is really what that's used for.
that's awesome. So needed. Do you see patients outside of your area or is it just in your area?
So if they need medication and
Hmm.
treatment, they need to be in the state of Georgia.
Gotcha.
If it's for counseling purposes and coaching and things in that nature, then the sky's kind of the limit. But I can't order blood and I can't do medication, so I have to just be very careful with that.
That makes sense. Yeah, absolutely. Well, everyone, check her out, check her website out. I think that this is just the future when it comes to, this other aspect of women's health that's really not paid attention to enough and talked about enough. So, thanks again for being on the show.
Thank you so much.
That's so great. And I'll see you guys next time.
Bye.